record.
Good afternoon, everyone. I am Twin Tran, APCHO's Training and Technical Assistance Director. On behalf of APCHO, I welcome you to today's webinar, Addressing Nail Salon Worker Patient Health, a Health Center Guide. Due to overwhelming responses and requests for practical strategies from our first webinar about over a year and a half ago on the disparities faced by nail salon workers, we have teamed up with Asian Health Services, an Asian American, Native Hawaiian, Pacific Islanders serving health center that has developed innovative services for its nail salon worker patients to develop a toolkit to assist health centers to improve care for patients who work in the nail salon industry. So in this follow-up webinar, you will learn about the role Health Center can play in addressing the critical health and safety issues faced by nail salon workers, as well as strategies to help you implement a program for your organization and community. We have a panel of speakers who will share their expertise on this issue. Julia Liu is the Program Planning and Development Director at Asian Health Services. She is also the co-founder of the California Healthy Nail Salon Collaborative. We also have Tu Quat, who is the Director of Community Health and Research at Asian Health Services, as well as the research scientist for Cancer Prevention Institute of California, based in Oakland, California. And finally, we have Dr. Mai-Ching Ling, an internal medicine physician and site director at Asian Health Services. Today's agenda will include a 60-minute panel presentation with time for questions and answers at the end. So a little bit about APCHO. APCHO is a national association of 35 community health organizations dedicated to promoting advocacy, collaboration, and leadership to improve the health status and access of Asian American, Native Hawaiians, and Pacific Islanders. Before we begin, some housekeeping details. Here we are looking at an example of the GoToWebinar attendee interface, which is made up of two parts. The viewer window, which allows you to see everything the presenter will share on their screen, and the control panel window, which allows you to participate in the webinar. The resources related to today's webinar are attached, and you can download them under the handout section of your control panel. Please note that attendees are in listen-only mode and will be muted during the presentation. You may submit questions in writing during the presentation by typing them into the questions field. We will be reviewing questions as they come in, but we'll address them towards the end of the presentation. Today's webinar is being recorded, and you will receive an email with a link to view a recording of today's presentation after the webinar. With that, I will pass the mic over to our first speaker, Julia.
That was established in 1974, and we serve over 27,000 patients in 12 Asian languages. And just like so many community health centers, AHS is a one-stop shop that provides a full spectrum of care. We provide medical, dental, behavioral health services, and recently expanded our service to include specialty mental health to meet the increasing mental health needs of our patients. Overall, our patients are predominantly low-income immigrants and refugees, with 95% at or below 200% federal poverty level, and the majority do experience linguistic isolation. Next slide. Our patient demographic is predominantly of Asian descent. So of the 93% that's shown here who are of Asian descent, we know that 69% are Chinese, and the next largest percentage at around 10% who are Vietnamese. Okay, next slide. So back in 2005, Asian Health Services began conducting outreach specifically to the Vietnamese community. And where else would you find the Vietnamese community? But oftentimes in nail salons. And so we had community health workers who were doing outreach to these shops, and the topic actually was really around diabetes and the importance of health insurance. And as our community health workers were doing this outreach, they began noting that really every worker that they talked to complained about some kind of health issue. And this wasn't just a handful of workers, but pretty much everyone that she spoke with. So at that time, I think it was over 50 of them. So when she brought this up, we thought this was very strange, and when we talked with even some of the doctors, and they mentioned that many of their patients who are nail salon workers also complained about acute symptoms and oftentimes had concerns about their health, or if they were pregnant, they asked questions like whether to continue working in a salon. So we really started looking into this issue more deeply and why this is happening, and made the connection that workers are handling products that contain very harmful chemicals on a daily basis. So Asian Health Services knew that there was something going on and that we should respond as part of our mission of services and advocacy, having that dual pillared mission, and established a coalition that we'll be talking about a little bit later, as well as implementing numerous activities within the clinic to begin addressing what we discovered to be a public health issue. So I'll be talking more about these later, but wanted to turn it over to Tu, who will go into detail more of what the chemicals are and what are some of the root causes for how and why workers are experiencing these health issues. So I'll turn it over to Tu. So next slide.
Thank you, Julia. So we can go on to the next slide. Just to add on to what Julia was saying, well, we did realize that workers in nail salons are exposed to a number of chemicals. Part of the problem is that we don't always know which chemicals, because there's been a lot of loopholes in what manufacturers of nail care products need to disclose. So a lot around what's put into these products. But what we know based on some of the common nail care products is that there are a lot of chemicals. And this list here is just an abbreviated, and I really emphasize abbreviated list of the chemicals in some of the nail care products. In the nail care services, they use all kinds of different products, from nail polishes to nail polish remover, and then if you start thinking about artificial nails and gel polishes, those are additional products. And within some of those products, there are chemicals of concern. Uh-oh, the slide just switched out. But the table, when we go back to it, shows both the nail care use as well as potential health effects within those chemicals, and then the route of exposures. Most of them are through inhalation as well as dermal absorption. I'm not seeing the slide on my screen, so I think it's some technical difficulties, but I'll continue. It's really important to note that for some of these chemicals, they are linked to things like cancer, like formaldehyde. It's a known carcinogen. But then there's other chemicals like dibutylphthalates, which are endocrine disruptors. So that can cause a lot of problems down the line, especially if we're looking at hormonally mediated cancers like breast cancer, as well as it can cause developmental and reproductive effects. So dibutylphthalates, toluene, those are some of the chemicals of great concern. And then there's chemicals within artificial nails like methyl methacrylates and such that cause a lot of respiratory problems. Next slide. I wanted to just highlight a few of the studies that we've done with Asian Health Services and our other community partners. So after the collaborative, the California Healthy Nail Salon Collaborative was established, we were funded by the California Breast Cancer Research Program to conduct one of the first studies focused primarily on Vietnamese nail salon workers. And so during that time, there was a lot of attention on nail salon workers about all the things that they're doing wrong and how they could be infecting customers, but there was really no study to examine what some of the health problems are. So we initially went in, did some focus groups with the workers and owners, and then were able to collect 200 surveys directly with the workers from 74 salons. And it was, at the time, one of the earlier studies that looked at what some of the health concerns were. And our major findings is that half of the salons that we were looking at had poor methods of ventilation. What we mean by that is they may have one door that's open, but there was not a second passageway for the air to go through the salon, or they had ventilation machines that weren't working properly, weren't plugged in. Also, when asked, 80% of the workers had health concerns for working within the salons, but reported that they had very little choice in terms of work options. And then nearly 50% of them were reporting what we call acute health symptoms, so headaches, dizziness, difficulty in breathing, skin irritation. And the reason why we believe they were work-related is that we would ask them the question, well, would these symptoms disappear when you took off time at work? And often the answer was yes. Next slide. As a follow-up to this initial study, we actually went back and decided we wanted to do some air monitoring. So we were able to recruit 80 salon workers from 20 different salons to wear what we call a passive monitor. I'm sorry, the picture is a little distorted here, but you can see that it's something worn on the collar during the work shift. And we're able to analyze those monitors to see basically what a worker really is breathing in during their work shift. And we had select chemicals we're looking at, one of which was toluene, which is a chemical of concern. And in our study, we found that the levels that we're measuring from these passive monitors were twice as high as what's recommended for indoor air. So what we, as office workers, even within the clinic, would expect, within the salons, it was double the levels that is recommended. We didn't use occupational levels because, for the most part, those occupational standards are so high that it's really hard to pass. And there's always been issues with how they're set. So we decided to use what's recommended indoor air for California. We also did what we call stationary area monitors and found methyl methacrylate, which is a compound that's been banned in its 100% form within nail care products since the 1970s, but we were still detecting it in the air. So what does that mean? It means workers and customers are being exposed. We also looked at total volatile organic compounds, which is a general measure of the different types of organic compounds, and found that they are higher than what's recommended. And again, the workers were reporting that they were experiencing a lot of these acute health symptoms. Next slide. We also did a study where we wanted to look at the cancer risk within this worker population. So in California, we have a cancer registry that collects about 98% of the cancer cases that are diagnosed within our state. We knew that nail salon workers and hair salon workers in California, as well as in many other states, have to be licensed. So you actually have to go through all the training and then take a test and be licensed by the Board of Barbering and Cosmetology. We were able to collect that licensee file and link it to our cancer registry. The end result for that particular study focused on cancers that we did not see any specific excess cancer risk for any of the sites. However, we did note that for cancer, if we're looking at cancer, this was a fairly young cohort. So often cancer is a disease that occurs for most sites to those who are older, and then there's also a long latency period, so about 20, 30 years, and most of the workers we were looking at them working about 10, 15 years at the time we were doing the study. So we felt like it's something we need to continue to do to see once there is a longer latency period. Next slide. We did the same study, but this time we were able to take the licensee file and link it to those women who gave birth in California. And taking data from just what exists on birth files, so birth certificates and such, and information collected at the hospital, we did find some higher risk among those who are Vietnamese manicurists and cosmetologists to give birth to children who are small for gestational age. That's one of the outcomes we looked at. So we compared those who are licensed as Vietnamese manicurists or as cosmetologists and compared them to the Vietnamese population and did find some increased risk. In addition, we also look at maternal complications during their pregnancy and found an increased risk of gestational diabetes for both manicurists and cosmetologists. And when we looked at just the Vietnamese population compared to the Vietnamese workers compared to the Vietnamese population, that risk also increased more than the general population. So these are just a few studies that we examined just to look at because the question we always get is, are there health impacts? And while these are still earlier studies, it was very interesting. And the reason why it's really important for the reproductive health piece is, like as I mentioned, the chemicals we know do affect the endocrine, does affect endocrine disruption, and during the pregnancy period, it is a window that we're really concerned about, both for the mother as well as for the child. Now I'll hand it over back to Julia, who's going to explain more about the collaborative work.
Yeah, thanks, Sue. We're very extremely grateful to for her, really her groundbreaking research in this field. It's been instrumental in our design of activities and our comprehensive work in the field. So, we knew that addressing the health disparities and issues the nail salon workers experience is very complex. So we worked with APSHO to pull together a toolkit that summarizes activities we implemented, materials and information that was really helpful for us when we first began our efforts to address the health issues of patients who are nail salon workers. Next slide. So this is just a snapshot of the toolkit and of the content. And of these, I'll be highlighting very briefly the 4 areas that are in red. So general background about nail salon workers, what tools and materials are included, on how health centers can address health disparities in this population, a training that we developed in collaboration with many of our partners, and then specifically how Asian Health Services launched a unique coalition that has really propelled what we do at the clinic to another level. Next slide. So the toolkit contains materials that provide the overall landscape about nail salon workers that we thought would be helpful for other community health centers who have patients who are in the industry. I'll just highlight a few statistics. We know that in California that there are over 129,000 licensed manicurists, and actually there's over 300,000 cosmetologists that we know, many who are licensed to do nails. 1 in 4 manicurists actually work in the nation actually works in California, and we know that up to 80% are of Vietnamese descent. In the nation, the nail salon industry, there's approximately 400,000 nail salon technicians, and these are mainly immigrant women from Vietnam, Nepal, Korea, China, and even from Mexico and Ecuador. And we know that from the Bureau of Labor Statistics that on average nail technicians earn under $23,000 a year. But this actually doesn't capture even the invisible population of unlicensed workers who often maybe make $30 a day for 10 hours of work. Nationwide, we know that 58% of nail salon workers are of reproductive age, and according to the Bureau of Labor Statistics, over the next decade, we know that the personal appearance industry actually will grow faster than the U.S. economy. We know that many, again, of the workers in this industry are often recent immigrants and refugees just trying to navigate their way, to the United States to achieve sort of American dream with few resources and trying to adapt to, an unfamiliar country. So we know that while salon workers may be concerned about health impacts, they're also concerned about their own economic livelihood and how can they actually still maintain their jobs in order to feed their families and have basic and address their basic needs. So next slide. So in the toolkit, we do have a section around how health centers can address health disparities. And again, I'll just quickly highlight this. I want to give time to Dr. Nguyen to really go through some key cases how we began to address some of the issues and utilize the provider screening tool that we include in the toolkit. So we've divided into kind of a patient approach, and this provider screening tool will be a way in which providers at any community health center can use when they see patients that are in this industry. Patient navigators, we can utilize them in order to assist patients in the nail salon industry, really connect to any needed social services, and really identify any type of appropriate resources to those who are experiencing maybe even legal issues. From a community approach, we have included materials that we felt would be very helpful to be able to hold health and safety trainings or workshops at a health center. And these materials can be utilized and adapted based on each center's unique circumstances to conduct outreach as well. When we first started, we found that actually bringing just a simple brochure about our center and also that we were going to be doing a workshop was very helpful as we started to get the word about the different types of trainings and workshops that we were doing at the clinic. Next slide. So after we established and implemented initial workshops, we actually partnered with the UC Berkeley Labor Occupational Health Program to develop an OSHA-approved nail salon-focused health and safety curriculum. OSHA is the Occupational Safety Health Administration that really oversees worker health and safety protections. And the curriculum that we developed overall was really designed to reach low-income, low-literate communities. So we took key parts of this comprehensive curricula and adapted and developed ready-made fact sheets in the toolkit that we felt would be useful in being able to tailor just a very basic workshop. So these ready-made fact sheets include topics on preventing aches and pains. Many patients in the nail salon industry often experience these pains because of the repetitive movements that they make daily in servicing their customers. And there are tips that clinicians and providers can offer to reduce these ergonomic hazards. And we've also included tips for reducing chemical exposure, given the chronic and cumulative exposures that workers experience, as Tu has explained and through her studies what the impacts are, and also how to prevent transmission of infectious diseases, given that workers often will come into contact with blood or bodily fluids when providing services. We've also identified a few key patient recruitment strategies. When we first began, again, we posted flyers in all exam rooms about our trainings. We also distributed them to all of the community members where we knew our patients congregated, such as churches and schools, and we announced the workshops in our local ethnic media. We knew that a lot of our patients listened very often to various radio stations and also a very popular magazine that were distributed to salons on a weekly basis. And then just building on what we've done in the past with our prenatal workshops, we would also provide low-cost incentive items such as nitrile gloves during the workshop, just to help get the word out that there are items that would be helpful for workers to bring to their workplace to utilize for their protection of health and safety. So if there are people who are interested in more of the full curriculum, because the toolkit just gives a very brief snapshot, we would be more than happy to provide our training manual and scripts and additional handouts, such as we've developed something around health and safety phrases that workers can practice in English. We found that trainees actually really liked these type of activities because it also gave them a chance to practice their English skills. Next slide. We also included in the toolkit a case study of how Asian Health Services built extensive partnerships with diverse organizations, and through that established what is the California Healthy Nail Salon Collaborative. And the collaborative is a coalition of 20 organizations throughout the state of California focused on the health, safety, and rights of the nail and beauty care workforce. And member organizations that we partnered with have expertise in environmental and reproductive justice, public health, policy advocacy, community organizing, and base building. And we also established a research advisory committee that is led by Tu, comprised of research experts from around the nation. And we felt it was really important to engage in these diverse partnerships really to impact the social cultural needs of our patients and community. Next slide. So I think you could probably click on it one more time. Yeah. So really just a brief about the collaborative. I mean, the formation of this really has enabled Asian Health Services to extend its work beyond its clinical walls to really impact systemic change and target root causes. And AHS is now just one of many partners committed to nail salon worker health and safety. The collaborative is really grounded with community outreach and organizing as its base. We really want to ensure that the voices of our patients and our community members in the nail salon industry are heard effectively, and that really that they're given the skills to make their voice heard as well. The collaborative has really been an important vehicle for also establishing public agency and academic allies and providing a space and momentum needed for policy advocacy, research, and community outreach groups to really come together to think about cross strategies and activities both locally and nationally. And as a result of these partnerships that have gone outside our clinical walls, we've been able to establish collaborations with even county and city agencies and have been able to bring to scale what are called healthy nail salon recognition programs that can recognize nail salons that prioritize their workers' health and really implement best workplace practices. And I will now turn it over to Mai Chi, who will talk a little bit more about the tips for providers and go into some case studies. So, Mai Chi.
Thank you, Julia. Good afternoon, everyone. My name is Mai Chi Wen. I'm an internal medicine physician at Asian Health Services, and I provide primary care services to a very diverse population in Oakland. And one of the things about the Nail Salon Collaborative and its initiatives, it's very personal to me, is that I'm a Vietnamese provider and provide services to a very large Vietnamese population in Oakland. And on a personal level, my mother was a former nail salon worker. And so the things that we've discussed today have all come up in terms of, how to maintain health, chemical exposures, and the working environments that our patients and our communities are affected by and going through. And so as a provider and as a physician, I'll be going over some tips for fellow providers and other healthcare folks working on the front lines with patients. I think we have a great responsibility, in addition to taking care of the patient overall, is to think about not only diagnosis, but we also have an opportunity to really partner and engage with patients where, easing concerns, maintaining their health, and most importantly, preventing adverse outcomes in terms of prevention and education. And so one of the things as a provider that gets kind of missed or goes under the radar is looking at people's jobs and the communities that they live in. Now it's becoming more trendy and people are more aware of the social determinants of health and how important that is. And one of the things about that is the occupations, the jobs that people do, and how it affects their health. So some of the things that we talk about for providers is that by discussing occupational health, it really will give patients a feeling of safety by providing them helpful information about their jobs. As you know, we serve a very large low-income monolingual community, and telling folks to quit their jobs or stop working is not a practical or financially possible thing. And so how do we identify the occupational related health impacts and hazards for them, and really making some practical steps and solutions for them to continue working and making money and making a living wage so that they can support their families and at the same time be healthy. Additionally, too, and Julia had also mentioned, really just taking it out of the provider-patient exam room and really connecting patients to the community and resources that are available to help them. So next slide. So as Julia mentioned, there is a provider screening tool. So it can seem very overwhelming when patients come in with multiple complaints. And where do providers start from in terms of occupational health, especially if you have a Vietnamese patient coming in and they are a nail salon worker. So some of the things we always ask is, the usual, how long has it happened? Where did it come from? What do you think causes it? Some of the things that I've actually started to ask folks is, what kind of work do you do? And if they tell me they are a nail salon worker, when they come in with skin flare-ups or muscle aches or pains or dizziness or some type of respiratory condition, one of the first few questions I ask is, what kind of work do you do? And then, are these symptoms improved at home or when you're off of work? And so if the answer is yes, then it really keys in into certain areas of their condition that might be triggered by the work that they do or the chemicals that they're exposed to. So some of the, as you can see on the screen, the writing is a little bit small, but you'll have access to this later, is that it's a workflow diagram when patients come in, key screening questions. But the biggest ones to look out for, as we talked about, are skin flare-ups, muscle and joint pains, and dizziness. And so a key question that we ask over and over again is, what makes it worse? What makes it better? And if these symptoms improve after they stop working, then it really helps you to kind of discuss further what kind of conditions that they're working in. And so as a clinician, we're really uniquely positioned to help our patients who work in nail salons understand the medical complaint and the complaint that may be related to their job. And then also when the patient expresses concerns about working in the nail salon, it can really be a starting point for engaging with the patient and partnering with them to find tips and key strategies that they can do at their job. So next slide. So I wanted to start with some case studies that I come across in my practice. So the first case is a 27-year-old Vietnamese patient, and she comes into my office complaining of these red, itchy rash on both of her hands. And then if you can click on the next. Yes. So one of the things, and so we'll be going through the cases, is that I usually ask, how long have you had this rash? And so she said that she's had this rash for about a week. And then the next few questions I would ask would be, how often do you have the rash? And she says that on and off, she's had it for years, but it doesn't seem to get any better. And she's seen me multiple times and multiple drop-in visits with other providers and has been prescribed various topical creams, which do help, but only temporarily. And so she's back again with a similar rash and a similar complaint. And so using our provider screening tools, I ask her about, when do you get this rash? And so she says she gets it more frequently after working at the nail salon. She doesn't wear gloves because it makes it harder for her to do her jobs, and she's noticed customers complaining that they don't like it. And so it's from an aesthetic point of view, and also from a tactile artist, the patient feels like she isn't able to perform her best if she has gloves interfering with her painting nails or designs. And so those are some of the things that we have received information about during our visit with her. And so as I'm looking at her case, it would be very easy and a 2 to 3 minute visit if I just prescribed her a prescription for a cream and make it go away. But it really then would miss all the other areas where we can impact patient health and also education, and also to stop the cycle of repeated visits. Since you've looked back and she's had this for several years, it temporarily gets better, but it doesn't necessarily go away. So knowing that she's a nail salon worker, what would I do? And so for this 27-year-old female, one of the things I think about is her last name. She gets it more when she's working at the salon, and one of the things that could help prevent rashes on your hands is usually it comes in contact with chemicals. And so one way is to provide a barrier between your hand and the actual chemicals by wearing gloves. But as you can see, she's saying that she doesn't like to wear gloves. Number one is that it makes it harder for her job, and also that customers, she's perceiving that customers wouldn't like it if she wore gloves. So in terms of education, one of the things that I would like to start with her is asking, what type of gloves has she tried? And usually the cheapest types of gloves are the latex gloves that are available in salons. And so, I'm not sure if folks have worn latex gloves before, but some, they're kind of floppy, they don't fit well. And for folks who've used latex gloves to either mix chicken or, paint or do some other things, you can tell they're very flimsy and they're actually permeable to a lot of chemicals. And so we actually do not recommend latex gloves or any other type of gloves. The only gloves we recommend for folks, if they are to wear gloves, is the nitrile gloves because they are non-permeable to a lot of the chemicals. And then in terms of the patient concern that she won't have the tactile kind of stimulation or being able to use her hands well with gloves, there are gloves that are able to be fitted more to her hands and to be able to have that same surgical precision, as you will. So as you know, surgeons and other people in other fields definitely need to use their hands, and they wear gloves to help protect them from blood and other chemicals and body fluids that they're exposed to. So in terms of getting appropriate gloves that give you also protection, but also that fine skills kind of sensation is possible. So just kind of engaging with the patient on that sense. And then trying to figure out how to prevent these rashes from occurring is number one with gloves, and also to ask her about, what kind of work does she do? And so for a lot of patients, they could be nail salon workers, but there's also folks who do nail and also hair work as hairstylists. So making sure that is she solely doing nails or doing hair and nails? And then if she's a nail salon worker solely, what kind of chemicals is she exposed to? So there's several different types. There's nail salon workers who do acrylics, and they're exposed to a lot of the dust and powder and liquids and gels. And then also if she does a lot of massaging, so a lot of the nail stylists and manicurists will also kind of massage customers in terms of, so they're exposing their hands to a lot of water, chemicals, and a lot of skin irritation. So making sure that the patient is aware of good hand washing techniques, and also to moisturize to keep that skin barrier intact, because that's her main protective layer. And really will prevent her from getting rashes over and over again, and using the steroids sparingly. And so those are some of the things that we talk about with her. And then I would probably see her then more frequently to make sure that the recommendations that we've made, and if she's able to try them and has it helped with her rash, and to notice if there are any triggers. And something that folks may miss too is that I would look at, the first line, 27-year-old female. So she's young and she has a very long, career ahead of her. And so as a 27-year-old, she is of childbearing age. And so another question I would probably ask her is she pregnant, and does she plan on becoming pregnant? And the reason I would ask those things is because counseling for a lot of patients who are pregnant or come in pregnant, they don't worry about themselves, but when they get pregnant, there's another human being that they're responsible for, and so it changes a lot of things for patients. And some of the things they ask me is, I do really need this job, but is it safe for me? And what are the things that I can do to, prevent any harm to my unborn child? And so this is a perfect segue to really educate patients about prevention and safety, and we can talk about more in the following cases, that it would be good for all patients and not just pregnant patients, but they are particularly vulnerable in terms of preventive techniques. So we can go into the next slide, the next case study. So the next case study is not a childbearing age, but an older woman who actually do see a lot of patients who go into the Vietnamese nail salon industry. They usually are older Vietnamese women, and it's because it's a field that requires a little bit of English, but that they're able to use their skills in working with their hands, and they get an opportunity to interact with clients, and so it's a very popular line of work for them. And so our first case study was very young, and our second case study is an older woman. She's been doing this for several years, and she's coming in complaining of multiple joint pains in her neck, in her back, in her wrists. And so it's kind of hard to pinpoint where this is all coming from. It's kind of like patients coming and saying, I have pain all over. So we're really going back to our provider screening tool, knowing what kind of work she does, and asking more of those relevant questions. So if you can click on all those questions, thank you. So one of the things we go through is, how long have you had these symptoms? So she's saying it's worse in the past 2 weeks. And I would ask, how often? And so she says she gets it on and off for the past few months, but it really is bothering her for the past 2 weeks, more so that she's unable to really sleep well or kind of do her job effectively because of the pain. And so the next few questions I would ask her is, when do you get these symptoms? And then she said, when I lay down and rest at night, it does feel better. It's worse after working, especially during busy holidays, and after working long hours. So a lot of these patients work 8 to 10 hour a day. They work 6 days a week. Some work 7 days a week. And so, and then a lot of the work is seasonal. So during the holidays or during busy, times, they work very, very long hours. And so this can exacerbate, any type of neck, joint, or muscle aches that they may have, from sitting in a position too long or bending too long. And then this is a cumulative effect, and it occurs more when she's working long hours or during a busy time when there isn't time for rest. So some of the things that I would look at, and ruling out any fractures or any falls, if this is just, coming in and this neck pain just develops over time, some of the things I would ask her is, what type of work does she do? Does she sit on a stool? Does she bend over? Does she sit at a table? And how is she sitting? And what kind of work tools or positioning does she adjust herself for her work? And how many hours does she stay in that one position? As a lot of us, if we were to sit at a computer or a desk in the same position for 10 to 12 hours a day, 6 to 7 days a week, we'd probably get some sort of carpal tunnel or neck strain or eye strain. And so the nail salon workers who do this repeatedly on a day-to-day basis are no different, and they do get a lot of ergonomic issues. But in terms of education for ergonomics, it's not as readily available as you would have at, like, saying, working in an office where your ergo people could come in and help you adjust your desk and your keyboard. So some of the things that we try to do in terms of education is really to see how the patients are working, and asking them to really adjust their chairs and their tables and their lighting to make sure that it's a comfortable position for them. And also, one of the things that I've noticed that my Vietnamese patients do is that they always tend to go towards the patient or the client. So if their customer is, in a certain position, they would, try to not disturb their customer and go towards them and just kind of bend over, lean over. And so some of the things that we ask them to do is actually to raise the customer or the client's hand or foot and to them. So bringing the client to them and raising the client's hand or foot in a comfortable position so that it makes their work easier, and also it helps reduce any type of strain or pain. And also for them to slow down. I know it can be very quick and fast, but really to have them take breaks. And then also if they're able to really do a lot of any type of stretching in between clients to reduce the strain on their necks and backs. So next case. So this last case is a 45-year-old Vietnamese male salon nail worker, and he's actually an owner and a worker, and he's coming in complaining of dizziness, headache, and some difficulty breathing. And so some of the questions I would start asking him, if you can click down those questions, thank you. So I wanted to highlight that a lot are Vietnamese female workers, but there are also nail salon workers who are male, and they're also owners in addition to workers. So there's actually a unique opportunity to engage with the owner as a patient and also as someone who can affect change at their nail salon. So some of the things I've asked this patient is, how long have you had the symptoms? So it looks like it started yesterday. And how often? I said it's his first time getting these symptoms. He was actually very worried that he could be having a heart attack because of the dizziness, the headache, and the difficulty breathing. And so I started asking him more questions and was able to rule out that it was not something cardiac or coming from the heart, but rather it was very atypical and not usual of, heart attacks. And he had described that these symptoms occur mainly when he's working. And so usually as a nail salon owner, he doesn't work every single day, but usually steps in when his workers are out or when the shop gets busy. And so he's noticed that it had come on when he started working. And so some of the things that is very common for a lot of nail salon workers is respiratory conditions. So we had talked about, skin issues and also muscle and joint aches. But there's a lot of kind of nebulous things that can be described, such as dizziness and headaches. And so it can come from a lot of things. And so when you combine that and ask more questions, we realized that a lot of his concerns were coming from the ventilation in his shop. And so one of the things is his shop was in a strip mall, and so he doesn't usually let the door open. And usually in the winter times, if it's cold, he'll keep it closed, and so it really reduces the fresh air and ventilation from coming in. So just talking to him about that. And so one of the things I talked to him about is really very good ventilation. So either if there's not ventilation at the table, really opening the doors or windows if the weather isn't too cold, and also really choosing safer products for his nail salon. So products that don't involve some of the chemicals too had mentioned. The biggest ones are what we call the toxic trio, the toluene, the formaldehyde, the dibutyl phthalates, and also using good practices in terms of teaching his staff about good body position, good practices of disposing chemicals, and using the proper protective equipment in terms of gloves. And then also learning more about healthy nail salons and how he can be a healthy nail salon and really create a work environment that's good for him and also his workers. And next slide. Okay, so I'll turn it over to Julia.
Yeah, so just to wrap up, we really wanted to encourage other health centers to get involved, and please utilize this toolkit and feel free to reach out to all of us. We want to be a resource to all of you so that you can be able to provide nail salon health and safety educational resources to your patients and be able to establish whether it's a workshop or a training. And then lastly, you know, the opportunity to join the collaborative is open. We also have a National Healthy Nail and Beauty Salon Alliance, so it doesn't have to be just in California. So if there are any questions, again, please feel free to reach out to us. Next slide. These are all of our emails, so feel free to reach out to myself, to Tu, or to Maichi regarding any types of needs or additional questions. And I think that ends our presentation.
Okay, well, Julia, Tu, and Maichi, thank you so much for your time on our panel today. I know we received multiple emails about participants not being able to see the PowerPoint, so immediately following the webinar, we will send that out to you. And with the remaining time, if you have any questions, feel free to contact us so that we can answer them offline. There was a pre-submitted question prior to the start of the conference, so I will use this last minute to ask the panelists. Given sort of what you've learned and the current political environment, what kind of tips do you have on really outreaching and engaging those in the nail salon workforce?
Well, I still think that the strategies that are laid out in the toolkit are still relevant. I think that even with the current administration, the health and safety issues are still similar, and I think that there still are opportunities for health centers to intersect at this level. So in terms of outreach, I again would suggest getting the word out if there is a workshop or a training that a health center would want to establish. I think that's where we first started, and we have brochures that we utilized and placed, gave out to our providers and placed them within sort of the educational materials section for our clinic, so that if there are any providers who did encounter nail salon workers, that they could easily provide that information to them that provides the tips and for ergonomic hazards and acute symptoms, to address acute symptoms, but also again with flyers, just being able to let them know that there are resources out there. So again, happy to share anything that we do have so that no one else has to recreate the wheel. And we do have materials that are already translated in Vietnamese.
Okay, great. Well, with that, it is 2:31 Pacific time. So as promised, we will send out the PowerPoint and then the recording of today's talk as well. Thank you so much, the panelists, and thank you for everyone who stayed on despite technical difficulties. And have a great rest of your day. Okay, bye-bye.